All right, ladies and gentlemen, this is episode 8 of the Healthcare Growth Cycle podcast. Today, we've got a special guest on, Nate Sundheimer, Director of Digital and Technology at Wipfli. And Nate's got a ton of extensive experience in health tech and digital technology on the consulting side, and a number, even on the hospital system side. I've kind of been looking through your profile on LinkedIn, Nate, kind of looking at some of your work experience leading up to this show. And it's been a long time in the making. I think, when did we meet? Was that back in November of last year?
Yeah, it was definitely probably back in the fall via Josiah in Boston.
Yeah, so introduced via a mutual connection in the Columbus, Ohio area. And I'm just looking here too. It looks like you're a Forbes 30 under 30 and a Crain's 20 in their 20s as well, award winners, recipient. So that's awesome, man. It's really great to have you on the show.
Thanks, man. Appreciate it and happy to be here.
Awesome.
Happy we could make this happen.
Yeah, no, this is great. So just on that note of kind of your beginnings, I'd like to get into your academic path, because you have from someone who's actually studied and then kind of transitioned into the field that they actually studied. I think you're kind of a rare case there. So I'd love to kind of just walk through all the way back to undergrad and then through grad school and your credentialing there in healthcare. I think it'd be really, really fascinating for the listeners.
Yeah, I'd be happy to. I went to the College of Worcester and studied neurobiology. And truthfully, my focus at that time was dead set on pursuing a career in clinical medicine. And I thought that's what I grew up thinking I wanted to do. That's what, it was a one-track mind in that sense. And unfortunately, I missed some time from school due to a pretty rough leg injury. Got a staph infection, missed about 1.5 to 2 years. And I was able to graduate in 8 semesters, but transparently through I had a lot of post-operative and complications afterwards. And I realized that with my degree, there were 2 trajectories. One was to go to medical school, and the other one was to work in more of a laboratory setting. And while laboratory work is really, really important, it is not my cup of tea. It is slow. It is monotonous. And I, at that moment, really knew that I needed to differentiate my skill set. So at that inflection point, I thought to myself, what is the most ultra utilitarian thing that I can do? And I asked my father, who's also in medicine, and he says, why don't you try to, go to business school and, learn that side of the house. And so I took his advice, was very, very fortunate to matriculate into Case Western's program and, specialized in innovation and healthcare innovation. And to be honest, it was quite a unique transition going from understanding endocrine pathways to hopping into an accounting class and not understanding what ROI stood for.
Yeah.
So there was a bit of a learning curve, but very quickly, fell in love with the business of healthcare and, can't be any more appreciative for the professors up there, like Mark Botruba and JD Silvers. I mean, just absolute like titans in the industry. And so, as time went on, I had the sort of the clinical understanding, I had the business understanding.
Yeah.
And then, as time went on, I realized that there was a missing component, especially when we're talking about getting things moving in healthcare. And that was really the engineering piece. So a lot of folks, they can talk clinically, they can talk on the admin side, or they can only talk to the engineering or the IT side. And so that's why I pursued a 3rd degree in healthcare systems engineering from Johns Hopkins. And so all of those
Wow.
things really helped me, really be a translator between each of those 3 distinct entities. And so, when you think about those 3 domains, when I think about my career, when I look back on my career to date, there has been a consistent thread, and it's always been drawn to the intersection of healthcare, innovation from the business end, and then execution, obviously more so on the engineering side. So career-wise, outside of academia, I started in academic and clinical innovation environments at Case Western and around Cleveland Clinic Ventures.
Yeah.
And, that's really where I saw how powerful new ideas in healthcare can be, whether they're breakthrough technologies, digital tools, new care models, therapeutics, you name it. But I really got to see firsthand how incredibly difficult it is to move ideas into operational reality. Um, and unlike other industries, healthcare isn't an industry where you can just simply deploy something because it's exciting. It's so multifaceted, it's so complex, and it has to align with reimbursement structures,
Yeah.
regulatory frameworks, workforce realities, finding ways to be deeply ingrained in clinical workflows. And long story short, if it doesn't integrate, it doesn't survive. So moving on from that arena, I ended up transitioning into the venture capital world where I served as the lead for US healthcare partnerships at Plug and Play. And that was a really cool experience in the sense that I got to exist at the intersection of startups, health systems, um, pharmaceuticals, payers, you name it. It was, and a few federal entities as well on the healthcare side.
Yeah.
And through that experience, I really reinforced something important along that same line of thought. It's innovation doesn't fail because ideas are bad. And I would say, primarily fails because organizations are just complex between finance, clinical leadership, ops, IT. You know, in a perfect world, they're all aligned. But the reality is, more times than not, they're not.
Politics and ego.
So, I mean, if that governance isn't clear, your execution capacity is extremely limited.
Yeah.
Um, and so moving to present day, through those experiences, I realized that I wanted to focus a little bit less on innovation theory and the innovation theater and really focus more on operational transformation. And that's what's ultimately brought me to Wipfli. So what Wipfli is though, is, we're a firm and we serve middle market healthcare provider organizations. So think of rural hospitals, community health centers, senior living providers, home health agencies, so on and so forth. And so these organizations are deeply mission driven and often operate with extremely tight margins. And they still face the same regulatory and financial pressures as the larger systems, but without the same resources and internal infrastructure. So where I sit now is, it's not just advising on strategy, but it's also sitting alongside these organizations to help them actually execute. So it's aligning finance, aligning compliance, aligning operations, and then, in more my realm with digital strategy and AI, and it's just cohesively congealing all of that in a cohesive way.
Yeah.
Um, and so that's really my story to date.
Has what's been your experience with, like, working with rural hospital systems on revenue cycle management? Like, is it just run in a lot of spreadsheets oftentimes, and then you're going in there trying to digitize and automate a lot of those solutions that they're currently reporting RCM out of?
It really depends, to be quite honest. As you and I both know, innovation and capability exist on a very, very vast spectrum. There are some where, sure, there is still a little bit of pen and paper, and there still is some Excel manipulation. There's also systems that should have been sunsetted a long time ago, but they're still running. And then we have other organizations that have adopted newer systems, but don't fully understand how to utilize them, or they're not utilizing them to their full
Yeah.
capabilities. And so, the overarching comment that I always make, when we start these RCM type of conversations is that, we're living it. RCM revenue cycle, it's still shifting from reactive to predictive, and we're in transition. Some cases it's there, other cases it's not. But we know the process. Historically, claims are submitted, denials occurred, teams responded after the fact, cash flow surprises were discovered weeks or months after, so on and so forth. And so, now from like a technology standpoint, when we're talking about the RCM space, these AI and predictive analytic capabilities are now allowing organizations to anticipate those problems upstream. And, we can go through examples, whether it's
Yeah.
predictive denial modeling,
That's
cash flow forecasting, whatever. Um, but the thing is that we're really trying to, shift the mindset around it because, when we originally think of RCM and revenue cycle, we think about it as billing infrastructure, but I really think of it more as a strategic intelligence engine. So for a lot of these mid-market providers with these narrow margins, you know, having those predictive capabilities and having that
Yeah.
extra help and support and relief from AI, can really stabilize ops and reduce that
Yeah.
volatility that we see.
Well, you free up cash flow and you're able to better serve your patients with all the different expenses that go into doing that. So if you don't have the cash flow, it's just you're not gonna have any capacity to serve your patients in the way that you want and need to. Yeah. It's just interesting because like my world has primarily been revenue cycle for DME in the last year. And so that's why I kind of pressed on that a little bit more. But it really is closest to the value chain. And from a perspective of growth, which is kind of the central theme of the healthcare growth cycle podcast, I always enjoy talking about the perspectives that you and other leaders have brought about RCM and its importance with patient outcomes. So I appreciate that.
Of course.
Yeah. Um, let's just let's kind of go into maybe from a growth standpoint, and how you actually lead your team. Like how do you engage with healthcare companies at Wipfli currently?
It's a great question, and, the consulting response is it depends, and,
Yeah, right.
you know,
We're gonna just keep
uh,
saying it depends throughout the. I
it depends.
identify with that.
Depends on the profile, depends on the maturity, but really at the end of the day, I kind of break it down into 3 different domains, and one is more so focused around profile development. So, it's really just understanding the characteristics of the organization, understanding what tech infrastructure they have, understand, the amount of beds that they have or the operating model and whatever that is. So because you can only get so much info online and you can only get so much info from, doing your own due diligence, but it's always great to actually hear how an organization operates on a day-to-day basis. And that really gives you sort of the bedrock. Like, it gives you exactly what you're looking for, and it gives you, the foundation which you're gonna support and help this organization, whatever
Yeah,
profile it takes. Um, but the next thing that we really focus on is really understanding, what are their goals, what are their ambitions, but how does that relate to a number of core tenets that exist within the organizations. I mean, you can think of cybersecurity, you can think of data analytics, you can think about that as far as, optimization of core infrastructural technologies like your ERP, CRM, EHR, whatever that is. And so when I walk through a number of those core tenets, in my mind, it's sort of like a waterfall cascade in the sense of, okay, well, if you're broad, if your bandwidth, from a workforce capacity or from an implementation capacity is not where it needs to be, or your cybersecurity isn't, totally up to date, not totally up safe. And if you want to have AI conversations or, advanced technology conversations, I'm going to stop you in your tracks right then and there and say, like, hey, we can have those conversations, but it's not going to be worth your time nor your money. Like, we really need to focus on building this from the ground up.
yeah,
And then ultimately, once you figure out those priorities and you figure out those areas for innovation potential, then it comes to this third component, which I really sort of equate it more to the ability to execute from an operational standpoint. So it's saying like, hey, do you have dedicated budget for this? Do you have a dedicated team? Do you have dedicated governance? Do you have, if we're going to roll this out, do you have the actual tools to and people and personnel to be able to actually
yeah.
execute? And for us, that's
Absolutely.
it's important to know because some organizations want to do it all by themselves. Some organizations want to be totally hands off, and then there's, everything in between. So it's really more so just understanding, how much or how little we need to be involved as we, walk through that process.
Wow. Yeah. No, that's huge. And I guess going to like, at what point are the hospital systems that you're working with ready for AI tools? Because I know that's just I'm just like looking at our set of questions here, and I'm just trying to I'm always trying to surface a little bit about AI, but like how do you go about saying yes, this company is ready for AI, or no, this company is not at the level of maturity, or it wouldn't make sense to introduce an AI tool.
Yeah. So, I mean, generally speaking, I take a very precautionary approach just because, if you're an executive at one of these organizations, your inbox is inundated every single day with hundreds of emails from vendors that are, hyper aggressive, trying to get their product out there saying, hey, like we have a tool that's going to save you X percent, or, whether it's time, money, whatever that may
Yeah,
be. And when we look at the spectrum of understanding, we have some leaders that are very pessimistic, and they're, I don't want to say they're laggards, but they're taking their time to understand what's ultimately going to stick around. Like I mean, some things come and go. And then there's others that are, very, very hopeful and think it's going to be the save all. And what my role really is to really root that in pragmatism. And so when you we'll go through that exercise, you got to get back to that point of assessing that foundational readiness. So it's like, is your data structured and trustworthy? Do you have a defined governance ownership model? Do you have your compliance and security frameworks in place? Does your team or the users of this AI capability, or the tool, do they understand the capabilities and
yeah,
limits? And so without that foundation, AI is nothing more than a distraction.
speaking my language.
And
Yeah,
where I sit, I would say that we prioritize those administrative use cases first, rather than those autonomous clinical decision making tools, just because they are a little bit lighter of a lift, and also they're not as complex, and they're not as it gives you a little bit more breathing room to figure it out. So whether that's on the revenue cycle side and you're doing the denial triage, whether you're doing your schedule optimization, documentation assistance, whatever that may be, but they're all measurable and low risk. But the other thing that I'll mention, though, as I mentioned, the inundation of emails and vendors reaching out to a number of these organizations, the other really critical discussion is the build versus buy framework, when you're
mhm,
talking to these folks. So sometimes, the best AI solution is already existing or already embedded within an organization's existing EHR ERP. They
yeah,
just haven't flipped the switch on, or they're already using it and they don't really understand that they're using it, and they, for whatever reason, aren't fully utilizing that capability. But when you build, as you well know, when you build within the existing system, that reduces your integration risk and your governance
yep,
complexity. But when you see all these other startups and these, with these shiny capabilities, you know, those startups, like, they really offer some really differentiated value. But at the same time, that adds vendor management and integration considerations. And if you have limited, operational bandwidth, then that's just another phone call. That's another team that you have to work with. And so when we think about that process and we think about, moving on from having that foundational readiness, we go through a number of conversations where it's like, can this be built internally? What's the timeline that this, for this to be built out and deployed?
yeah,
Do you have an existing vendor that already has this capability? Is adding this new capability worth the operational fit? And so when we think about it, it's just, very simple. It's just like, start and identify the operational pain, tie AI to the ROI, build the governance, and then, make sure that everyone follows suit and is accountable as you are walking through that
yeah.
process.
Have you seen AI move like a tangible needle on return on investment? Like, have you seen it actually produce
Oh,
a
yeah.
lot of profit and cost savings for
Yeah.
hospital systems?
Yeah,
Because it's
absolutely.
like,
And
yeah, just I just say that because so many people are like, maybe it's really more so just hype, like 90% or whatever the stat is of AI implementations fail. To hear from someone like yourself on the ground floor of these hospital systems that it does have a tangible ROI is
yeah.
pretty incredible.
And I think, there's a number of use cases out there, and I mean, you can
Right.
look those up ad nauseum. But I think, when we're talking to organizations that are maybe a little bit more adverse, or that, they're a little bit more, um, that they question it a little bit more. I think a lot of it is a framing question as well, because a lot of people say, "Oh, we're implementing AI," and it's saying, you really have to change the structure of the sentence or the structure of thought, and it's like saying we're actually changing a specific pain point. So we're reducing documentation burden. We're decreasing denial work, rework. We're
The
improving
outcomes.
access, and
Yeah.
having those defined measures, it doesn't really matter if it's an AI or just a tool or just an automation capability or,
Yep.
just flipping on a switch with
Such a good point.
a system you already have. But it's, it's important to,
Yeah.
make that distinction, but
But yeah.
and rework the question a little bit that way as well.
Yep, like, jobs to be done is I think it's a theory, but yeah, like, just, like,
Yeah.
what is the actual outcome? I don't care how it's done or what you're implementing, it's just, like, what is it doing for the business? How is it actually improving our
Yeah.
operations and our bottom
Yeah.
line? Yeah,
Exactly.
man,
And
that's good.
I think the other part too is, you know, especially from a workforce standpoint, you and I both know that, like, AI isn't here to replace jobs or to replace people. It's really here to augment their existing functions, and then also allow them to dedicate time to more important things. And so, when I
Yeah,
think about like AI and I think about, technology and innovation as a practice, I don't necessarily think about it as disruption. I like to position it in my head as relief. For example, if a physician gains back time from documentation, that's support. If the revenue cycle teams reduce rework, that's relief. So it's
yep.
just making sure that, you know, once again, we get back into this conversation of reframing how we're thinking about it.
I love this. I mean, this is so pertinent too with a lot of like the scare tactic articles that have been published about AI in the last week. There was one on Twitter that went viral. I forgot the gentleman's name. He runs an AI company. Um, but yeah, like, especially in regulated industries like healthcare, I keep saying, where this is now going to free up our time. Now we can actually focus on patients and put all of our focus on how do we better serve them in the current function that I'm working in within a larger hospital system or health tech company. Like, at the end of the day, it always comes back to the patient. You're never, in my opinion, never going to replace humans in the loop treating that patient. And you can have that impact no matter if you're the physician that's directly treating the patient all the way to the admin staff that's helping their overall hospital
Yeah.
experience and stay be better.
Yeah, 100%. And, we both know that, you know, healthcare doesn't change overnight. And you definitely don't change healthcare by pushing against it or pushing it into a direction it doesn't really want to go. It really moves, and the needle moves when there's demonstrated value that whatever innovation you're bringing to the table strengthens your stability, your ability, and your experience. As long as it touches those things, then, then it's a less of a sisyphistic, uh, push up the hill. It becomes much smoother.
Wow. So this is a bit of a broader question, just pivoting away from AI for a little bit here. Um, have you dabbled with value-based care models at all with the clients that you serve?
A little bit, and
Okay.
it's in my mind, it there's a little bit of a pivot, but not too great of a pivot, because at the
Okay.
end of the day, that value-based care, that still requires that foundational structural readiness. So, kind of following those same fundamentals, there's a focus on 3 layers when it comes to my line of thought. And the first and foremost one is data integration. So it's, organizations, they have to connect clinical outcomes, utilization trends, cost data, social determinants. And basically without that integration, that risk can't be managed. And on top of that integration, there still needs to be that added element of translation and making sure that it's actionable to whoever is reading it, whether it's on a clinical side or an
The right
admin.
codes, right? Yeah.
And then that second part is really focused on workflow redesign. So it's, you got to find the care coordination, close the gaps, make sure that that's all embedded into your daily ops. And basically, when we, especially when we're looking at burnout, a lot of the times it's because there's some sort of value based work that's layered on top of fee for service workflows. And if you're trying to do those, trying to work with those two things, and like, sure, like, makes sense that people are going to get burned out. And then lastly, we think about it in the sense of financial modeling. So, obviously you have to understand your downside exposure, your upside opportunity, your break even thresholds. And so without that modeling, we do a lot of that work just to help organizations feel less risk averse to engaging in those types of contracts if it's appropriate for them. Um,
Sure.
so, I mean, basically, as you and I both know, it's like moving on from the foundational infrastructure, the value-based care really succeeds when clinical, operational, and financial domains align. So still getting back to our data analytics and,
Yeah.
all that fun stuff.
Yeah. No, that's really great. Um, well, I guess just pivoting because we've got about 5 minutes left.
Sure.
What are some big goals that you have? And let's get a little bit more on your director level now, outside of the technicalities of healthcare leadership. Um, what is a piece of advice if someone was looking to, be a healthcare consultant or leading a healthcare consulting team? What would be one of your biggest like takeaways and pieces of advice that you could give someone that's striving to be like a director of digital like yourself?
Sure. Um, I think you almost and transparently, like, it was a big transition moving from the venture capital world into the consulting world. And the narratives change so much on a day-to-day basis, and the needs are so vast and they're so complex. And so, it's if I'm giving advice, it's really just to be malleable, be willing to learn, be willing to understand. You know, you can hop into a specific service line, or you can hop into a couple of organizations that have a very similar profile, and their day-to-day ops and the way that they operate are totally different. So it's more so making sure that you have a continuous learning and a continuous growth mindset. I think that's extremely, extremely important. Um, I would also say another thing is just really learn how to leverage your peers, because you don't know everything. I don't know everything. I reach out to my team. I reach out to the partners in the firm. I reach out to. I mean, I still, when I have a question about a startup, I still reach out to some of my old VC contacts, just
Awesome.
because it's, they're doing the diligence to a degree that I don't necessarily have the time to do. So it's, continue to build that network as well, uh, both internally and externally. And then I think another big thing that was really helpful for me is to build your personal, board of directors internally. So, it was a new world for me, and so there's a number of really awesome people that I lean on within the organization. Some are within healthcare, some are not. Some help me understand what's happening in the healthcare space. Some help me just understand the some of the nuances of consulting,
Yeah.
and that's another thing that's, very top of mind when it comes to how do you, set yourself up for success.
Yeah. What's one of the biggest challenges of leading a team?
I mean, the truth is like, you know, I I'm part of multiple teams. So I like where in my role, I sit horizontally
Okay.
underneath a number of partners and across all the different provider domains that we have. And the thing is my team is fluid. Like it changes all the time. It depends on what we're working on. Are we working on an EHR? Are we working on an ERP? Are we doing a data analytics solution? And so the team changes quite often. And so from an organization standpoint, that's really key, just to make sure that you stay on top of everything. It's probably just the organization. Um,
Yeah.
and then also learning how to work with competing timelines that are operating at different speeds.
Ah,
And, it's fine if you're working on 3 or 4 projects, but, if there's, 10 or 15 different things, you're getting pulled in a number of different directions, and you still gotta go to conferences and still get your 9 to 6 work done.
yeah.
Um, so it's really just learning how to manage all of that as well, and learning to delegate when needed.
Wow. Well, that's great, man. Great insight. I'm sure the listeners are going to have a ton of information gold mines out of this one. Not only the technicalities of revenue cycle, like managing a bunch of different domains within a hospital system, how you actually drive ROI with AI, but then just the leadership components too. So it's really, really awesome to have you on. And with the last like minute that we have, Nate, I would just give you the floor. And where can people follow you, reach out to you? Like, what kind of platform do you like
Yeah,
to use?
yeah, thank you. I'm honestly, if you have any questions or would love to get in contact, I'm very accessible via LinkedIn. So I know it's Nate Sundheimer, but on LinkedIn it's Nathan Sundheimer. I think there's one other Nate Sundheimer in the world, but only one in healthcare.
Nice. There's a
So
few Christian Steinerts. I know that. They're all
yeah,
out of Germany.
crazy enough, crazy
Yeah.
enough. Um, there's actually another Nathan Sundheimer in the world, and he actually lives on the opposite side of town, the opposite side of the city that I grew up in, which is wild. Never met,
No
no
way.
relation, but yeah, there's two of
Th-
us. But yeah,
that is
anyway,
wild.
that's just
What
a
are
little
the
fun
odds of
fact.
that?
Yeah. Yeah, LinkedIn's
Man,
always the easiest way
awesome.
to get hold of me. And if you want to learn more about Wipfli and what we're doing in healthcare, feel free to access our page in both healthcare and then also on the tech and innovation side as well.
Awesome. Yeah, and we'll put all the links in the show notes for the listeners, so make sure to check those out. And ladies and gentlemen, this is episode 8 of the Healthcare Growth Cycle podcast featuring Nate Sundheimer. Nate, thanks so much for having you on.
Thanks, Christian. Really
And
appreciate
we'll
it.
see you guys. Yeah, we'll see the listeners on the next episode. So thanks a lot.
Awesome.